Epilepsy affects almost 50 million people all around the world every year. Although the widely popular option for treatment of epilepsy is medication, you would be surprised to know that almost 30% of the patients suffering from epilepsy are not cured by medications alone. So what about these patients? Hi, my name is Dr. Raveesh Sunkara. I'm a neurosurgeon practicing at Arete Hospitals, Hyderabad. Today, I would like to talk about a topic which is not widely popular, epilepsy surgery. Almost 30% of the patients suffering with epilepsy do not get cured by taking epilepsy medications, and that too multiple medications. They end up suffering with side effects of medications even though their control of seizure is not achieved. So, for these patients, epilepsy surgery can be a good hope. Now, you might say that surgery sounds very intimidating, but let me tell you that surgery for epilepsy has become completely safe now. And by going through this video at the end, you will have trust in what I am telling you. Most of the patients who come with epilepsy to us are always initially treated with medications. And once the medications are not getting their seizures under control, only then we start investigating them to understand whether they are suitable candidates for epilepsy surgery. Imagine a child who cannot go to school because he is suffering from these seizures on and off. Or imagine an adult who cannot secure a good job because he is suffering from this epilepsy. And by taking these medications so often and high doses, and that to multiple drugs, they become so drowsy that they cannot perform anything with interest in their life. Surgery gives these patients the confidence, the freedom and quality of life they deserve. And most importantly, a hope for their good future. So what exactly is epilepsy surgery? In simple terms, epilepsy surgery is removing the part of the brain or disconnecting that part of the brain which is responsible for the seizure. Now you would ask me, how would you identify this part of the brain? We do some tests like video EEGs, MRIs, and in some patients, some specialized tests called SPECT, SPECT scans, to identify this part of the brain which is causing the seizure. And after successfully identifying this part of the brain which is causing the seizure is when we plan for this surgery. The success rate of epilepsy surgery is truly remarkable, to an extent that in cases like temporal lobe epilepsy, we are seeing complete resolution of seizures, almost requiring no medications post-surgery. Generally, we can expect almost 70 to 80% resolution in most of the cases. Not only that, getting seizure free, we are also seeing a lot of patients having a good improvement in overall quality of life, alertness. The benefits of epilepsy surgery do not stop at only being seizure free. In fact, a lot of studies and even our personal experience says that most of the patients undergoing epilepsy surgery end up having a better quality of overall life and also better cognitive function in the long term. So what are the different types of epilepsy surgery? Epilepsy surgery is a completely personalized and tailored plan according to each individual patient. But broadly, we are able to divide epilepsy surgery into different types of surgeries. One of which is resective surgery. In this, we go and resect the part of the brain which is responsible for seizure. The second type of surgery is disconnective surgery. For example, corpus callosotomy. In this, we disconnect the part of the brain which is causing seizures from the regular brain. Of course, there are newer modalities like vagal nerve stimulation or DBS surgeries that we perform for epilepsy. Trust me when I say that epilepsy surgery is completely safe. You or your loved ones, if you are suffering from these kind of seizures which are not getting controlled by medication, do consult your nearest doctor and take an opinion about such epilepsy surgery.